Hey everyone, we're a small but mighty group today. Thanks, Loan, for the chance to join you guys. My name is Jesse Stigile. I use he/him pronouns, and I live in Kitsap County, on kind of the western side of Washington. I live in Port Orchard, a little bit outside of Tacoma. Um, and I am the Community Support Services Program Manager at DCYF. I work for our Division of Partnership Prevention and Services, PPS. And my work mostly revolves around basic needs programming. And so when we say basic needs, we're talking about kind of supporting the everyday needs of families, things like food, gas, transportation. We'll talk more about that in a little bit, but there's lots of different programs in DCYF, and I get to support in that programming that we'll be talking about today. Concrete goods is one of those. I do a bunch around concrete goods programming. We'll talk about that some, but there's a lot of different basic needs supports at DCYF at kind of different stages of family involvement with our agency. So I'll share a bunch about different areas there. My background is actually in the nonprofit arena. I kind of started my work in the social work space in Calgary, Alberta, in Canada, and worked there. We started a nonprofit organization and a couple different programs. One that focused on housing for youth and young adults that were moving into the city, specifically Indigenous and First Nations youth. They were moving into inner city Calgary for the first time. We did a bunch of kind of culturally responsive leadership programming with them. And then I also worked with low income and homeless youth in the city we started a property care business kind of that flipped rentals, and then we hired youth and young adults in that space, use that as a platform to create job opportunities for youth that oftentimes didn't have an ID, didn't have access to transportation, oftentimes didn't have housing. And so that was their starting point to trying to access a job, which was very, very difficult in the traditional job setting. And so we created a job environment where we could do mentoring with youth and young adults, but also get them a paycheck on the same day for some work that they could do in a single shift. So that's kind of where my journey started. That ties in today, though, is because a lot of the work that I did there was around creating a foundation of really trying to think about how do we support those basic needs of youth that are often thought to not be as successful or to experience challenges or barriers in the city that got in the way of them being able to achieve success. But oftentimes, what it really came down to was once housing was accessed, once food was taken out of the equation, once they had utilities paid, and all those factors were kind of removed and pushed to the background, those kids were able to thrive and were really able to step into a lot of the other kind of goals that they had for themselves. And so I'm a big believer in that, not just for youth and young adults, but also for families in general, for parents, um, and believe in advocating for that. I'm going to share some slides today and open that up real quick. And the slides that I shared today, they'll be shared out after the presentation. So you'll have access to any of the links that we look at today and anything in that space. Give me just one moment, though. I'm having some trouble getting behind my share settings here. All right, there we go. All right. So what are basic needs? When we talk about basic needs at DCYF, we're really talking about those essential fundamental goods and resources that all families need to sustain daily living. These are things that oftentimes many of us take for granted, but when you don't have access to one of these things, it can disrupt a lot of different areas of life and make things very challenging. So things like housing, things like access to safety items, food and groceries, your utilities, access to a phone, the ability to call someone in an emergency or to set up an essential appointment. Um, Pregnancy and baby supplies, if you have a newborn, so many essential goods and items that are needed in order to care for a young child. things like clothing and personal care items, hygiene supplies, transportation, the ability to get to the places that you need to go, access to healthcare, access to childcare. This is the framework that we use at DCYF to talk about basic needs. Each of these elements is a essential thing to sustain daily life and for kids to thrive and for families to flourish. And so um, this is the framework we use when we advocate for programming and build out basic needs supports for families that we serve. And you can imagine, families oftentimes that are referred to DCYF are in situations where they're having to make tough choices between this month, do I pay for a utility bill or do I pay for our groceries? Do I go to an essential medical appointment or do I spend that money on gas? And when you're put in positions where you have to make tough choices like that, oftentimes there are risk factors that are introduced for children or risk factors that are introduced for families where they have to make impossible choices in order um, to navigate life. And so we try to take a proactive stance from a prevention perspective about how do we support families with these needs as soon as possible so that those things don't escalate and become a crisis. And if they have become a crisis, how do we help stabilize that to make sure that kids have access to these things and that they're safe? Um, we look at basic needs and child welfare prevention in a lot of different ways. We think about basic needs in the way that when we strengthen access to basic needs as a protective factor for families, we can reduce the risk of child abuse and neglect from occurring at all. So we can help families upfront before they ever touch the child welfare system by supporting basic needs. We have a lot of targeted approaches that focus on low-income families and community-based organizations that serve low-income families and provide some of these supports up front. They never even know it's coming from DCYF. They never see our face in it at all. They just see the community organizations providing support. We also, though, if a family is referred to DCYF through a CPS intake or referred to one of our services, we can support the basic needs of families in that space as well to improve safety outcomes for kids, but also to support permanency timelines to create secure guardianships and adoptions to stabilize placements, to help kids in transitions between placements. All of those things are also important aspects of child welfare prevention to make sure that those outcomes are improved for the kids that we serve. And then also, we even think beyond child welfare involvement for families that exit child welfare. We want to be able to connect families to state and community-based supports for the ongoing assistance to reduce the risk of future child maltreatment from occurring. And knowing that families who are successfully connected to different resources in their community that have a strong system of support around them are better able to be independent and to, address these needs as they come up without child welfare needing to be involved in the future. So all of these are aspects of the way that we think about prevention and how it ties to basic needs and supporting families. Um, this is probably a piece of legislation that's familiar to all of you. It's called the Keeping Families Together Act, or the House Bill 1227, and it has shaped a lot of the way that we approach prevention, but also just the provision of services at DCYF. And this was an act that was passed in 2021 that really passed several measures focused on safely reducing the number of children that were placed into foster care overall, reducing racial disproportionality in the child welfare system, and also supporting relatives to take care of children when they must be placed in out-of-home care. Um, and there are a lot of different perspectives that people have on this legislation, and a lot of different opinions that people have about it and its effectiveness in different areas. But the priorities, I think, are kind of demonstrate the way that basic needs connect to this legislation in several different ways. We use basic needs on a daily basis, basic needs supports on a daily basis throughout the state to support the safety of children and youth that we serve. We use them to reduce the risk of abuse and neglect from occurring. We use it both to prevent out-of-home placements, but also to support out-of-home placements when children are placed. And then also to facilitate safe reunifications for families for kids that are exiting foster care and returning to be reunified with families. And so kind of from throughout the entire spectrum, basic needs supports are a critical element and driven not just by House Bill 1227, but also by our agency's mission overall, also by our policies and practices that really focus on these different elements of supporting the safety and permanency of children. I want to share a little bit about kind of the research behind this, what studies show about material hardship, and what the relationship is between families that are experiencing poverty and material hardship, and how that connects to higher risk of child welfare involvement. Um, of all risk factors, when we think about different factors that influence a family's risk of being involved in DCYF, material hardship is among the strongest predictors of child welfare involvement, more than poor mental health or a mental health crisis, more than substance use disorder. Um, Material hardship is the strongest predictor of child welfare involvement. Things like, and when we talk about material hardship, we're talking about things like sudden income loss, the loss of a job, cumulative material hardships like how not being able to pay for a utility, not being able to afford groceries, as those things stack, that becomes cumulative material hardships. And also housing hardships are the most reliable predictors of child maltreatment when we anticipate the risk of child maltreatment occurring in a household. Low income families experiencing at least one type of material hardship are about 3 times more likely to receive a neglect investigation and about 4 times more likely to receive a physical abuse investigation. And that increases to 4 times and 7 times, respectively, for families who experience multiple types of material hardship. Things like not being able to pay for a rent or not being able or needing to go and get medical care, but not being able to go. As those things stack, the risk of maltreatment occurring um, increases significantly. Um, there's a lot of different reasons and theories for why this occurs. Part of that is the idea of cumulative stress. There's incredible amounts of stress that occur when you can't pay for these different factors or access these different needs for your children, which can influence a lot of different other behaviors that we see in homes that contribute to risk for families. There's also a large body of research that talks about protective factors that if you have a mental health crisis, for example, in a household, if all of these different needs are met and stable in your household, you're able to address something like a mental health crisis much more smoothly than if you have a crisis but don't have several of these elements in place. And so your ability to respond to hardships that occur in life, that occur for any family in life, are much more challenging if you can't sustain basic needs in your household. Um, I have included here a link for a presentation that a research and policy agency called Shape and Hall put together. It goes in really, really in depth about the relationship between material hardship and child welfare involvement, kind of at a national level. If you're interested in exploring that more, I put the link in there. I could give an entire presentation just about this alone, and that's not what we have time for today. So, but I did want to put that in there for people who are curious. The inverse, kind of as we were just talking about, is that when we provide concrete support in times of need to families, that's a well-evidenced child welfare protective factor. So things like childcare, increased access to housing supports, affordable health care, flex funds for concrete needs, all of these have demonstrated in study after study that positive reductions in child welfare involvement when these different components are more easily accessed. The rates of child maltreatment that we see and the referrals that we see to our CPS hotlines decrease. In addition to that, services that offer concrete supports to families, things like family preservation services or Triple P or home builders or promoting first relationships, services that we offer at DCYF to families to help address safety concerns. When we offer these services to families, those exact same services, if they offer concrete supports to families, are 17% less likely to experience subsequent child maltreatment from occurring than if we offer that exact same service but don't give any concrete supports at all. So services that we offer that also in tandem address basic needs with families are more effective in supporting safety and supporting the families that we serve. So we have an approach in DCYF where we bolster our services with concrete supports in addition to the parent education services that they might provide or the crisis intervention services that they might provide and use these things together because of what the research shows in this area. Lastly, it's so important as we talk about racial disproportionality in child welfare and the child welfare system that we also talk about racial disproportionality when it comes to economic hardship in Washington state. There's no way not to. It's a critical element of what contributes to the rates of referrals that we see in our state and to the risk that families experience. So maltreatment risk we know is more than 5 times higher nationally for children and families with low socioeconomic status. That's true at a national level across our country. But in Washington state, Black, Indigenous, and Latinx families are about twice as likely than white families to fall below the Washington self-sufficiency standard for meeting basic needs. So this is a body of research that the University of Washington put together. They update it every year. They go county by county by county, and they look at what they call rates of income inadequacy, and they compare that by different ethnic groups. And you'll see that charted on the right here. If you look at these different ethnic groups and the rates of income adequacy, the ability to afford basic needs with minimum wage rates and the average household income for different groups in these counties. These are the rates of income inadequacy that we see. We see Latinx, Black, and Indigenous families experiencing income inadequacy at far greater rates than other ethnic groups. And not coincidentally, these are the same ethnic groups that we see disproportionately represented in our child welfare system, in our rates of out-of-home placement and foster care, and also our rates of maltreatment. But we know that when we look at studies that control for child poverty, and when we look at different racial groups at high child poverty levels, any disproportionality that we see in maltreatment rates disappears. So if we compare Black families, if we compare white families, if we compare Indigenous families at high rates of child maltreatment, at high rates of child poverty, we see very, very similar levels of child maltreatment occurring. So we know that the disproportionality that we see is directly attributable to differences and likelihood of experiencing socioeconomic differences. And there's a lot of structural and historical factors that play into why that's the case in Washington state. This goes well above DCYF's involvement and is a much broader conversation about socioeconomic factors that influence our families of color. But it's an important consideration as we think about how we effectively serve families of color coming into our system and supporting the basic needs of all the families that we serve in order to address these disproportionate outcomes. I do want to highlight and just emphasize that while these are studies and while these are averages that we see in studies, and there are many families of color, there are many families of low socioeconomic status every single day that serve their families and take care of their families very effectively, right? But still an important consideration as we think about the disproportionalities that we see in our system and wanting to address those and respond accordingly. I put a link in here to the self-sufficiency standard for Washington that we were talking about earlier. It shares a lot more information about how that self-sufficiency standard for Washington state residents is derived, what kind of is included in their basic needs framework. You can look at that across different counties and learn more about the research about income inadequacy rates and how that's determined. I wanted to share this chart here that kind of looks scary for a second if you're not a research nerd, kind of like I am, but this shows a chart of Washington state locales. And when I say locale, it's a cluster of school districts or neighboring school districts that adds up to a population size of at least 20,000 people. So some of these is just like the Spokane, like one of these dots might represent the Spokane school district, or it might represent a couple clusters of rural school districts that are neighboring together that add up to at least 20,000 residents in that area. But these represent neighborhoods all across Washington state. And on one side here, you'll see our rates of CPS victims that we get for these locales. So if we go to these clusters of school districts and the area that they serve, how many CPS victims, how many rates, what's the rate of maltreatment that we saw for that area. And then also we look at child recipients of TANF, that's Temporary Assistance for Needy Families. It's a state program that serves families that are low income. And how many children do we have in households that receive TANF? And we use that as kind of a measure of financial neediness in these neighborhoods and these school districts. And what we see is that as the number of child recipients of TANF increases in a neighborhood, as the financial neediness of a neighborhood increases, the rates of CPS victims in that neighborhood increase. And that's true across our state. The more financially needy a community, the higher rates of child maltreatment that we see. And then vice versa, in some of our our least financially needy communities, we see the lowest rates of CPS victims in the entire state. And to illustrate this a little more, we know this at a community by community level that at DCYF, children are almost 4.4 times more likely to receive a referral that results in a finding of abuse or neglect from communities with high rates of children in financially needy households than communities that have low rates of financial need. Of our top 10 locales with the highest child TANF enrollment, 7 of those are also represented among the locales with the top 10 highest CPS victim rates. And you'll see that charted on the right here, some of the communities that we see with really high rates of financial need and how they score amongst our highest CPS victim rate offices. And then vice versa, I've also shared some information about low TANF enrollment, low financial need, and communities like Mercer Island, Bainbridge Island, communities around the Seattle area, really high concentrated wealth communities that have very low rates of CPS victims. And so all of this is really just to illustrate that material hardship, it's not just an opinion, it's not just a perspective. There's a very, very, very hard body of research that demonstrates how financial need connects to the risk that we see for child welfare involvement and the outcomes that we see in our system. And so this is an optional thing for us to address. It's a crucial thing for us to support as we think about interventions that are effective for families and reduce the risk of needing to be involved in our systems of care. All right, I'm going to shift a little bit now from talking about research to talking a little bit about the programming that we have at DCYF and the supports that we provide to families. So the first one I want to talk about is concrete goods that we distribute to low-income families through community-based prevention. So this is concrete goods and services that we give to families, again, without them necessarily knowing it came from DCYF. We contract with organizations across the state of Washington and then provide them funding to spend on concrete goods. They can determine the kinds of goods and the types of goods they want to purchase. And they can also qualify what it means when we say low income. They can make the determination of in what way they serve low-income families, what that looks like. They just need to be able to articulate that they are serving low-income communities. And then they can use that funding and distribute those goods and report back to us what they purchased, how they use that funding, and the number of families they were able to support. So we've done that now for about 3 years. We just launched into our 4th year of funding for this. We distribute $2 million every year and to about 90 organizations. And serve about 60,000 families across the state. And these are various organizations like early learning programs, family resource centers, food banks, different social service organizations, and other community organizations that distribute these goods. And these are things like grocery cards, groceries, food assistance, gas cards, transit passes, lots of baby supplies, diapers. school supplies. We have things like cleaning supplies and hygiene and clothes. So lots and lots of different supports that get out to the community through community-based prevention for low-income families before any child welfare involvement whatsoever. Again, because we know of that increased risk for child maltreatment, so we try to serve these families up front as a part of community-based prevention to reduce those things from escalating. Um, we also, like I said, augment a lot of the services that we offer to families with concrete goods. So when a family is referred to DCYF, either voluntarily or through a CPS investigation and a CPS pathway, we have a suite of what we call combined in-home services that we offer to families. These usually involve a provider traveling out to a household and then doing kind of session-based work with families focused on different aspects of safety or crisis intervention. Some of these are for young children, some of these are for adolescents, some of these are for the whole family, um, and kind of have a different focus. But all of these offer services in home and are augmented with concrete goods. And um, each of these can access $75 of what we call family engagement funds. And family engagement funds are things that help kind of get a service moving. So it might be something like a meal when you kick off a service, or snacks at an appointment, or helping with gas to come out and access your appointment. Things to help a family engage in those initial service appointments. And then in addition to that, they can access up to $500 per case with approval by their DCYF caseworker that's assigned to that case to provide a whole range of concrete goods to families, things like gas assistance, things like household items, in order to support basic needs of families as they come up when a service provider goes out to the home. Um, I've attached a link there to the Combined In-Home Service Provider Concrete Goods Guide. Um, and I can pop that open real quick if you want to see it, but it has a lot more information about kind of what our providers use to support families in providing concrete goods, and then also a list of all the different types of items that they might offer, as well as some recommendations for kind of ongoing sustainable community and state resources to support families beyond their involvement in DCYF. So again, lots of different types of items, safety items, personal care items, cleaning supplies, school supplies, lots of different types of things that a service provider might offer a family when they go out to meet with them. I won't go through this item by item here, but wanted to kind of give you a broad picture of what this looks like in some of the different areas that we serve families with here. And then in addition to that, we also then use concrete goods in our child welfare programs. And our child welfare programs, when I say that, I'm talking about things like our child protective services, our family assessment response pathway, family voluntary services, family reconciliation services, child family welfare services for kiddos and out-of-home dependencies. Extended foster care is also eligible for concrete goods. Any of these different child welfare programs have access to concrete goods funding. And our caseworkers use this concrete goods funding to support families kind of on a short-term basis. So the concrete goods program, we call that, is kind of the name of the basic needs program we use in these different programs, concrete goods. It's a short-term economic assistance program distributed by child welfare caseworkers to temporarily alleviate material hardship while referring out to some of these different state and community-based resources. Um, our caseworkers, when they make these referrals, they can be for up to 60 days per referral. So that's not like the first 60 days of a case or only 60 days overall. It's per referral. Each time they make a referral, it's supposed to be short-term in nature. So it might be a one-time thing like a gift card, or it might be grocery assistance kind of for on an ongoing basis for weeks up to 2 months. Or it might be something, I'll talk about this a little bit later. They can try and access an approval process to extend that out longer in some circumstances. But in general, those go up to 60 days per referral. And then in addition to that, they need to be able to articulate when they make their referrals how the provision of these goods and services connects to safety, well-being, stability, and a placement, or supports reunification for a family. Again, lots of similar categories that we've talked about up until now. It can be a lot of different types of items like housing, like safety, like food and grocery. And then there is no case cap for the total dollar amount that can be provided to support families that receive concrete goods on a case. But caseworkers have different approval thresholds. So for larger amounts of concrete goods that are distributed to a family, they need to get additional approvals. And so you can see that kind of listed there. They need, for any dollar amounts exceeding $500, they need a supervisor to review their request, and then an area administrator and an RA accordingly at those higher levels of concrete goods that are distributed to families. They also, if there are resources in the community or other organizations that provide for these needs, we use those first as kind of a first measure, and our caseworkers articulate that in their referral as well. What do they explore to provide for these needs before using concrete goods funds to address those different areas? Similar to the guide that I showed you before, the one for our in-home services providers, we also have a caseworker concrete goods guide that we use for our child welfare social service specialists that are assigned to cases. That's linked here as a public document that anybody can look at. And again, shows a whole list of different kinds of items that are available for families. I'll go a little bit more in a minute about the differences in goods that are available for in-home, unlicensed, and initial license placements, and how that differs from kind of a more limited basis of concrete goods that are available to licensed foster and licensed kinship placements. It's a little bit different for families who receive those foster care caregiver support payments versus families who don't, and kind of have a different set of needs there. More to come on that. More to come on that right now. So the different groups that are eligible for the full range of concrete goods programming includes what we call in-home households, families that are referred for child welfare services or for an investigation, but a child is still at home with their primary caregiver. We also can provide concrete goods to unlicensed or initial license placements during the home study process, including relative, kin, and suitable other placements. We can provide concrete goods to support voluntary placement agreements. And then we can also provide concrete goods to support youth that are in extended foster care, what we call EFC, or a supervised independent living placement, an SIL placement. And then on a more limited basis, which I'll describe in a minute, we have concrete goods for licensed foster placements at all our caregiver support levels. Here's some different examples, kind of at a high level, in different areas of what these types of goods can look like. It can include things like rent assistance, moving services. It can include items like beds and cribs to support a child or a baby in a safe sleep environment. We support things like, it might be administrative, like a credit check. We support with lots of different baby proofing items, fire extinguishers, lots of items that are provided during the home study process to help families provide a safe living environment during the home study process. We provide things like grocery vouchers and gift cards, formula and baby food, lots of things like diapers, pull-ups, sleep sacks, bassinets, bottles, pacifiers, thermometers for babies and baby needs. We can pay for utilities for through the concrete goods program, phones and minute cards, Wi-Fi, internet bills. Again, I won't go through item by item for all of these different elements, but lots and lots of different types of goods and services that we support with for families kind of in those different eligible categories to support with these different needs. Again, looking to community-based supports that are already offering some of these different areas, tapping into some of the partner organizations that we work with. But then if there's an outstanding need that's affecting child safety, child permanency, child well-being, or reunification, these are different areas that we can support with. We have different pathways in the child welfare concrete goods program for how we get items out to families. So these might be physical items in what we call office inventories. So each of our child welfare DCYF offices has a kind of on-hand access of items that are right there on site. And they can make a service referral and then go pick up those items and distribute those out to families. Um, Lots of our concrete goods take form in gift cards or vouchers. These are things like often grocery cards to a Safeway or a clothing voucher to a nearby clothing store. And so it might come in the form of a gift card or a voucher to a specific vendor. We also, if the items are large or heavy, exceeding 25 pounds, or the household is very far away, kind of outside a caseworker's normal area of coverage, we can often direct ship items right out to the household. So imagine like an Amazon package showing up at your door, that direct shipping an item to a household, or if it's something that needs on-site set up like a washing machine, maybe. If we're supporting a family with something like that, that can be direct shipped out. And then in cases where we're providing a service or like a utility bill, we provide those payments directly to a service provider. So those payments might be something that's paid to a landlord or to a mechanic. And we would collect a kind of a quote and then an invoice and then make a payment that way to support needs there. So all of these are what we call kind of our different distribution pathways of how we get items out to families. And then what does this look like for license placements? So there are some ways that concrete goods can be available for license placements. And then I'll also talk a little bit about partner organizations that can provide for some additional needs for kids that are in licensed care. Clothing vouchers is a big one. At initial placement, placement change, or if a child demonstrates an exceptional clothing need in a licensed household that's unmet by community resources, you can request from your caseworker a clothing voucher up to $400 a year. Um, and we have kind of different clothing stores depending on the community that you're in. So ask your caseworker about kind of what vouchers are available, what stores are available for those, and they can give more information there. But this is a big support. Clothes are expensive. Kids grow fast, especially teenagers and young children. So it can be a big support to advocate for, and I'd recommend advocating for it if this is an area of need for you. Not all families need that support, but some families can benefit from it. Um, we see a lot of times if you have a kiddo that's going through a placement transition, a lot of times you'll see a kid leave one house and they just, for whatever reason, they don't have hygiene supplies. They don't have any clothes on them. They don't have maybe some essential medical supplies or things that they're supposed to have there. And those can, we often provide concrete goods to children in those kind of transition points to support those plans, those placement changes. We consider on a case-by-case basis items that are related to exceptional developmental or behavioral needs for children in foster care. Sometimes we see like sensory items that are needed for a kiddo that has a developmental need or some specialized equipment. Looks kind of different for each scenario in each case. And so we look at that on a case-by-case basis. But yeah, if you're having kind of an exceptional need there, advocate for that to your caseworker and we can explore different options to support with concrete goods. And then also things like lice, pests, any bed bug treatments, if there's junk that needs to be removed from a kid exiting foster care or carpet cleaning that's needed. We use concrete goods to provide with some of those placement transition outcomes as well after a kid might leave. That's different than our caregiver claims process. If you have stolen or damaged property, I've put the link in for the caregiver claims process that can be accessed as well. Not on here, that's not part of our concrete goods program for licensed households, is also like we have our mileage reimbursement process and funds that can be accessed through there. I didn't include that in this space just because they're kind of different program components, but also a big part of how we support licensed households with transportation and gas assistance. I definitely, if there's probably one thing, if you're a licensed foster care provider, if there's one thing I can highlight, it is make the most of Treehouse. A lot of foster parents that don't know about all of the different supports that are offered through Treehouse. So I want to share about some of the different programs that they offer today and how we partner with them. So Treehouse is a contracted organization that we partner with at DCYF. Among many others, provide funding to Treehouse to support with these different needs. And kids that are in out-of-home care, if they have a dependency, if shelter care or in shelter care, or if they're in extended foster care, they can access these essentials and experiences. And they can access up to $1,500 per year in funding for these different areas. And so lots of opportunities here. I'll share about some of the programs. There's a Treehouse store, clothing store, and then or sorry, the Treehouse store that offers clothing, but also a bunch of other supplies like shoes, school supplies, toys, books, free tickets to events, and lots of other different essentials. That's an online store. And you need advocate to a caseworker or to a guardian ad litem to make a service referral in this area. But once that service referral is made, I think it can be made up to, you can make up to 3 requests a year for support in these areas. And um, either a caregiver or the kid themselves can go in and actually select a bunch of preferences that they have. And the Treehouse staff will put together a package of different items based on those preferences, based on sizes, and send that out directly to the household. So kind of like a big care package of lots of great stuff for kids. Um, this is probably the most important program I can highlight. We use it all the time. It's our just-in-time funding program. And youth in foster care and their caregivers can request funding for things like school fees, uniforms, college application fees, things like hair care, extracurricular activities, summer camps, lots of different types of items. And I'll open that up real quick and just show you guys some of what's available there. It'll let me. So here's some of the different categories of the just-in-time funding program. Covers everything from activity fees, camps, instruments, equipment, uniforms, lots, pretty much anything you can think of that you pay for a kid at school, like a student ID or a yearbook, any school fines or fees, school pictures. If a kid has a dance coming up they want to go to, like prom, um, the actual event can be paid for, but also for formal attire yeah, for kids that are getting ready for an event like that. Any kind of credit recovery or GED testing, tutoring, post-secondary fees, lots and lots of different supports that are available here. For any of our kids, but especially for our kids with different multicultural hair needs, strongly recommend some of the different hair care supports that are available through Treehouse. For some of those hair care things like braids, twists, conditioning treatments, they can get expensive fast. And so this is a really helpful support for kids that need some of that special cultural hair care. And then also things like identity affirming items, any kinds of like cultural items are included in that. If you're working with Indigenous youth. Things like ceremonial attire or regalia for cultural events can be paid for in that area as well. So lots of different supports there. IDs, passports, birth certificates, driving supplies, and supports lots and lots of different things here. So take a look at this. $1,500 a year of funding that can be accessed to support kids in licensed care. And Treehouse is kind of our go-to partner in a lot of these areas. And again, kind of the service referral is needed from a caseworker or from a guardian ad litem or a CASA. And they can share some more information about how to partner with you to make those referrals. Oh, are we going to jump all the way back? There's also 2 other programs that I wanted to highlight from Treehouse. They have their driver's assistance program. If you're working with youth or adolescents, Treehouse provides funding for driver's licenses, driver's education, car insurance. and also a bunch of different other areas. We've had them help with things like practice sessions when you're needing to do enough practice hours before your drive test. They support with kind of everything A to Z when it comes to a youth getting their driver's license. And then also they have their Holiday Magic program, which some of you may have seen or worked with before. And kind of the mission of that program is to make sure that every kid in foster care gets at least one kind of gift that's important to them in the holiday season. And so they'll send out an email to caregivers kind of asking um, if there are kids that are interested in enrolling in that program, and then also for their preferences of what would be a special or meaningful gift, and then send that out to the household around the holiday season. Links to all of these different programs here that are included in the slideshow, and kind of quick and easy ways to jump in there and take a look. A couple more slides and then we'll wrap this up here. Kind of outside of concrete goods, I also wanted to mention a couple other programs that we offer, primarily the kind of primary caregivers, those parents or guardians of families that are referred to our child welfare programs. It's not just our concrete goods, but it's also things like our child welfare housing program. We have a program that we serve families with housing vouchers, rent assistance, and housing navigation services. So if a family is experiencing housing insecurity or homelessness, we can provide kind of supports and vouchers through that program specifically. And then also for families that have been involved in child welfare, we have our child welfare continuing child care program where we can provide up to 12 months of free child care for families with an open child welfare case, or a child welfare case that's closed within the past 6 months. So trying to alleviate some of those child care needs, and that can be especially helpful in situations where we have an upcoming reunification and are needing to kind of support with some of child care needs in that area for families that need that or could benefit from that. So two different programs there, links to those if you're curious about those. And then beyond that, we talked about trying to connect families with state and community resources beyond their time at DCYF and beyond DCYF involvement. I wanted to share out this resource that we put together this year. This is a kind of a new DCYF page. It's our Basic Needs Community Resource Directory. And this is a directory of resources that can be accessed from our public DCYF website. It just lists different state and community resources that are available to all families. Regardless of whether you're DCYF involved or not, you don't need to have an open child welfare case to access these services. Each program has kind of their own eligibility qualifications and income qualifiers. Some have income qualifiers, some don't, but these can be really helpful resources if you're looking for different options to support families with, or recommendations to make to people, or maybe a support that's beneficial to you and your family. So feel free to explore that. Again, lots of our different basic needs categories listed here. Lots of different types of supports, both state and local programs. A couple that I want to highlight, you'll see Help Me Grow Washington listed here. And I put a link to that in our slides as well. Help Me Grow Washington is a kind of a resource navigation center that serves the entire state of Washington. And they can provide a resource navigator on the phone that can talk with any family. So if you're just trying to figure out what's in your community, hey, I'm looking for clothes in our area, or I'm looking for gas assistance in our area. I don't have a child welfare case, but I'm just looking for extra support. Or I do have a child welfare case and I'm looking for extra support. This is a great resource, would definitely recommend it. One of the things that you'll see is they have this option to call a resource navigator. And you can call one of their highlights or their hotlines, and then talk to one of their different resource navigators, and they can help with things like finding transportation assistance, basic needs supports, getting connected to childcare. If you're looking for education on parenting, maybe for early interventions for infants and toddlers, like you name it, tons and tons of different supports. They'll actually help you figure out, hey, what's in your local county that you can connect with? What are some of the different community organizations in your area? And then also based on your situation, what kind of state or benefit programs might you be eligible for? So huge opportunities here. And then in addition to that, I also just highlighted Childcare Aware of Washington, one of our primary childcare access portals. And again, they can support families that are low income with kind of figuring out options for childcare there. And then Washington Connection is kind of the main primary hub that DSHS, the Department of Social and Health Services, has for accessing the public benefit programs through the state. But also they have a similar portal that kind of can connect families out to different programs that are available to them for basic needs and different supports there. So three kind of different helpful resources that we refer families to a lot. That I would encourage you to check out, in addition to the many, many different resources that are listed in our basic needs community resource directory. Um, Sometimes you're looking for support and you're just not finding it. That's the reality. For those of us that have kind of been involved in DCYF services, you are probably familiar with these situations. You have a kid, you've been battling to try and access supports for them and just not getting the help that they need, or you have a kid that's in foster care that has very specific needs, very specific types of needs, and you're not sure how to provide the right supports. Or maybe you're looking for help, but your caseworker just isn't being responsive. You've asked for support and you're not getting anywhere. You know that you're eligible for services, but you're not getting any traction. Here are some different supports that you can reach out to that kind of can speed up that process and also help you weigh through different options and kind of what are some different supports that might be available and helpful to you. My email's here. You can reach out to me. I'm happy to help and support. But usually when we have a case specific need, that's like, hey, I have this kid on this specific case and I need to get this type of item for them, I'll direct you out to one of our regional concrete goods leads. Every single DCYF region has a concrete goods lead, and they are awesome, awesome, awesome people. I can't recommend them enough. They're super friendly. They understand kind of the mission of basic needs and supporting both youth in foster care, but also supporting families from a front end perspective. Definitely would encourage you if you're looking for that extra support. Maybe you want to staff a case around basic needs. Reach out to one of these different concrete goods leads. If you're not sure what region you're in, if kind of the concept of DCYF regions is unfamiliar or something that you're looking for a refresher in, I put a link there as well so you can look up the DCYF region map and see where your community falls and what region you're in, and which regional concrete goods lead to reach out accordingly. But again, if you have bigger, broader questions about concrete goods or our policies or our procedures, I'm happy to help with that. Happy to connect. Also, if you work with a community-based organization or you are involved in DCYF and you are curious about kind of putting our heads together about how we can more effectively serve families in kind of the area of basic needs, I'm happy to come together and talk about how we can partner well or fill in any gaps that you're seeing. So feel free to reach out and connect if you'd like to offer suggestions about ways that we can improve programming for families too. And with that, I am exhausted of hearing myself talk and would love to hear from you guys and any questions that you have. Thanks for tuning in and letting me share about this. And I'll hand it over to Luann to kind of transition us to the next step here.